Hello, friends. Good evening. Uh, Today, again, we are going to discuss one very important question. It's almost about 12 o'clock in the night. I have this habit of working late into the night after completing my patients. I expect the same kind of dedication from all of you. Anyways, the question I'm sharing the screen. The question for today is this a very important question. This has been asked in your All India entrance examinations the past couple of years. Which modality is used to measure the rate of blood flow in the pulp? Now, the important point, the important key term here is the blood flow, right? That is what the examiner is trying to ask from us. That what is basically the true pulp vitality tests. Now, there are different methods of determining whether the tooth is vital or non-vital. One is the most commonly used methods, which have been in use since the past many years and most commonly used. They are basically the indirect ways of measuring the pulpal vitality. How? By stimulating the terminal nerve endings, that is your A delta and C fibers, and more specifically the A delta fibers, because they lie more peripherally towards the dentine pulp junction. So, what are they? They are the electric pulp test, number one. They are the thermal tests. And in the thermal tests, we have the cold test and the heat test. Out of the cold test and the heat test, which one is a better pulpal sensitivity test? That's a cold test, right? So, anyways, EPT, cold test, heat tests are commonly known as pulpal vitality tests, whereas they are not true pulp vitality tests. Why? Because they are not directly measuring the blood flow or not directly informing us about the blood flow. They are rather stimulating the A delta nerve fibers, generating the action potential, right, which travels to the cerebral cortex and pain is perceived. So they are more correctly known as the pulpal sensitivity tests or the pulpal sensibility tests, right? Now, what are the true pulp vitality tests which measure the pulpal blood flow? They are laser, Doppler, flowmetry. Then we have the pulse oximeter. Then we have the dual wavelength spectrophotometry. And there is another way in which we can determine whether the pulp is vital or not, whether there is blood supply in the pulp or not. That is by the way of cholesterol crystals. So these four methods, 1, 2, 3, and 4, are the true pulp vitality tests, right? So amongst the options, if you see, which one is the correct answer? Laser, Doppler, flow meter, right? So this was the question of the day. I wish you all the very best. Keep studying hard and don't look at the clock. You just have to, whatever, if you are to compete in your competitive examinations, get a good rank, you don't have to see the clock. The only thing that you need to do is study, study, and only study, right? Best wishes.